Hi everyone, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today I'm breaking down one of the most misunderstood labels in women's health, the Black Box Warning on hormone replacement therapy. Now, if you've ever been told that HRT is dangerous because of this warning, stay with me. The truth is more nuanced and far more empowering than the fear-based messaging that women received. What is a black box warning? A black box warning is the FDA's highest and strongest caution on a medication. It doesn't mean don't use. It just means use with caution, use intentionally. Many perfectly appropriate medications have them. Why does HRT have a black box warning? It comes from data from the Women's Health Initiative in the early 2000s. Back then, a study was done to look at synthetic hormones, estrogen and progestin, to prevent the risk of cardiovascular disease in older women in like their 60s and 70s. Many women starting hormones way past menopause. That combination drove the language of the warning. It doesn't reflect modern prescribing or individualized care using today's data. Here's what the black box warning includes quickly and clearly. Combined estrogen and progestin therapy can increase the risk of breast cancer, heart attack, stroke, and blood clots. Estrogen alone can increase the risk of stroke, blood clots, and endometrial cancer if used without a progestin in women who still have a uterus. Both forms showed an increased risk of probable dementia when started after age 65. And finally, HRT is not approved for preventing cardiovascular disease or dementia. That's it. That's the entire black box warning. What does the warning not say? This is where women often get misled. It does not say that hormone therapy is unsafe for most women. It does not say that you should avoid hormones if you're symptomatic. And it absolutely does not say or reflect the growing evidence that age, timing of initiation, and type of hormone therapy, but also importantly, delivery of the therapy matter. Now, what does the modern evidence say? Today, we understand that starting hormone therapy within 10 years of menopause or before age 60 have a completely different risk profile. Transdermal estrogen and micronized progesterone do not behave like the oral hormones that were used in the WHI. In fact, transdermal estrogen and micronized progesterone are actually FDA-approved bioidentical hormone therapy that you can get from your doctor or your other healthcare provider. You don't have to go to a compounding pharmacy. You don't have to see a naturopathic doctor. Your regular doctor can prescribe these FDA-approved bioidentical hormone therapies with ease. Now, for many women, especially those struggling with severe vasomotor symptoms, hot flashes, sleep disruption, insomnia, metabolic changes, and quality of life impairment, menopause hormone therapy is not just reasonable, it's transformative. Millions of women have suffered unnecessarily because of misunderstood warnings. We need balanced information, not fear. So if you're considering hormone therapy, talk with your clinician, talk with me who understands the nuance, someone who looks at your symptoms, your timing, your metabolic health, and your personal risk factors. You deserve full information, not outdated fear, and you deserve care that reflects who you are today, not data from 2002. The exciting thing is I've also been recently certified through the Menopause Society as a Menopause Society certified practitioner who understands the complete data and information at this point to help women make the best decisions regarding their menopause hormone therapy care if they need it. Happy to work with you. Please go ahead and check out my website, consider making a telehealth appointment, or consider sharing this video with other women who have maybe been misled or misunderstood about the nuance of menopause hormone therapy and HRT. See you soon.